Good afternoon, everybody, and welcome to this afternoon's Public Accountability meeting. My name is Simon Dennis. I'm Chief Executive and Monitoring Officer in the Office of the Police Fire and Crime Commissioner, and I'll be chairing this afternoon's session. By convention, that's the arrangement during a pre-election period, but also, as colleagues and viewers will know, we're also in vacancy in terms of the role of a single elected individual. Accordingly, in line with the proposal, which I'm sure colleagues in the public will know, we have put to the Police Fire and Crime Panel for consideration later this week. Although I will be chairing, my colleagues across the exec management team of the OPFCC will be undertaking the scrutiny arrangements that ordinarily the Commissioner would lead on, and we'll be doing so collectively. There are also some other conventions that apply during the pre-election period, so we are discouraged as public authorities from announcing big decisions or making big announcements if those can be avoided during an election campaign period, so that there can be no suggestion that public resources are being used in a way which might influence the direction of the campaign. So although we'll have a full and interesting discussion this afternoon, if any of the themes that we cover might involve the announcement of a significant public interest decision, then we will seek to avoid dealing in any depth with that during this session, and that might be a matter that we will come back to later. In terms of what to expect, we have thematic presentations in the normal manner this afternoon, and also more general performance information to outline. Colleagues, if it's all right, we'll take questions at the end of the thematic presentations, and then as we move through the performance pack, questions can arise as we move through each theme in the performance pack. And in terms of the sort of technical housekeeping arrangements, for anybody presenting, for those colleagues attending at Chief Officer rank or EMT from the OPSCC, if colleagues could keep their cameras on. Other attendees, please do as you wish in terms of cameras on or cameras off. But in general, as is often the case with virtual public meetings, unless you're speaking, please do use the mute facility, because that just assists with clarity in terms of the broadcast. Okay. So much for the housekeeping matters. In terms of attendance and apologies, I think it's normally the case that we don't do a round of introductions at this meeting. Everybody has their corporate backgrounds on, so it's appreciably obvious which organisation each of us represent in our role. I know we have apologies from a number of colleagues who would ordinarily attend this session. So we've apologies from Jonathan Dyson, the Deputy Chief Fire Officer, from Phil Kane, the Deputy Chief Constable, and from Lindsay Butterfield, the Assistant Chief Constable in North Yorkshire Police. Does anybody know of any other apologies that haven't been offered in advance? Okay, thank you. And also by convention, as colleagues will know and regular viewers of this session will know, we don't table a formal written minute of this meeting. The previous recordings, which remain available online, stand as the record of the meeting. And in formal terms, we just note that that's the case. Does anybody have any matters that they're conscious are arising from previous sessions that need to be dealt with in the conventional sort of manner? Not seeing any indications, so thank you. Again, ordinarily, I would, from the chair, go through the questions that were received from the public, but on this occasion we've received no questions in advance from the public. We may receive some during the course of the session, of course, because we are promoting the broadcast in a proportionate way. Given the pre-election period, we are promoting the broadcast on social media. So if questions do arise, then we can perhaps take those in a similar manner to questions from colleagues in the virtual meeting at the appropriate point. Okay, so that takes us to item number 4 on our published agenda. That's the first of our thematic presentations this afternoon from North Yorkshire Fire and Rescue Service, entitled Enhancing Rural Services and On Call. To come from Dave Winspear and Phil Wild. So, Phil, am I handing over to you in the first instance?
Yes, please, Simon. Thank you for that. So, as Simon said, both Dave and myself will be presenting the first thematic presentation, and it is a presentation about our on-call service and how we will go about enhancing our services within the rurality of North Yorkshire. So I'm just going to try and share the presentation first of all. Hopefully, can everybody see the presentation?
Yes, that appears to be working.
Thank you. So we'll just flick forward then to the first slide. So our challenges, North Yorkshire Fire and Rescue Service experienced a number of challenges, as do many other services within the county of North Yorkshire. And the first one really to describe is simply the geography of the county. The sheer expanse of the county itself, as we know, it is the largest county in England, and with that brings a range of different challenges to us and other services. Again, the public of North Yorkshire will be obviously fully aware of this, but just put it in context. If you look at Bentham there on the left-hand side of the map, our furthest station over that way, all the way across to Filey on the right-hand side on the east coast, it takes 3 hours drive time to get from one side of our county to the other. Now, there is an extensive road network within the county of North Yorkshire, obviously, but as we get more into the rurality, that road network itself can become more challenging. We do have a good spread of stations, 5 stations, as you can see from the map. And with that good spread of 5 stations, we would like to maintain that. But obviously, at times, in fact, on a daily basis, we do struggle to keep every fire engine available across that range of stations. And of course, that in effect, so if we take one fire engine out of an area, that can in effect increase response times to the emergency incidents when they actually occur. Just to give you an idea about that availability of fire engines, and this is where it links very closely to the on-call availability, which I'll talk more about in due course. But on a daily basis, we have double figures of fire engines unavailable. So as you can see on that bottom table there, that actually is our fire cover model. So on the right-hand side, we've got a total of 46 fire engines. We do have them all available at times, mainly on the night time. But on the daytime, what we find on a daily basis is that we regularly operate at a minimum level of 32, and frequently we will dip down into that critical service delivery number. Now, obviously, that is an issue for us because if we, the emergency response across the county is what we try and aim to achieve all of the time, but we are aware that there are pockets of vulnerability around the county that if we cannot get to them very, very quickly, then we do need to increase our prevention activity and other services that we provide to them. Now, the on-call availability itself is a big issue for us, and we're trying to address the issues there. But I'd like to point out that it isn't just a local problem isolated to North Yorkshire. This is a national problem, and every service in the country, well, predominantly most services have an on-call service within their individual fire and rescue services, and we're all battling with the same sorts of issues around on-call availability. Now, when we have fire engines unavailable, we do have measures that we put in place to bring those numbers back up the scale as such. So where we have spare full-time personnel at our full-time locations, we will use those and detach them across some of the on-call stations across the county to bring them back online and make that fire engine available. We also have an operational staffing reserve, which is a pool of staff dedicated to going across the county and again plugging gaps in critical areas. And what we do on a daily basis is we assess what resources we have available in terms of both the volume of the resource, but also where that resource is available in terms of parts of the county. And we will then strategically fill the gaps so that we still maintain a good spread of cover across our county. Societal changes have taken a massive impact over time, and I'll talk more about that in a minute in terms of the actual on-call system and how the changes in society, which have been rapid over recent decades, have impacted more so upon our on-call availability and recruitment. And really, we're aware of all of these issues, and I will talk in more length as to what the on-call issues are and how we might want to address them. But a big, strong message as well is that funding is another challenge to us in North Yorkshire Fire and Rescue Service. We do have a limited budget, and of course, we want to make as many improvements as possible to improve that service to the public. But of course, we've got to work within a particular financial envelope, which is pretty tight. So we do struggle to save to invest in improvements as we would want to. So within our current fire and rescue plan and the care priorities set by the Commissioner, one of these is realising our potential. And that actually includes a direct reference about recognising and maximising the value of all of our fighters, and particularly the commitment of on-call firefighters and their employers, and really to improve recruitment and retention of that particular cadre of staff. The Her Majesty's Inspectorate came in 2018-19, and that report also highlighted that the areas of focus and improvement for on-call availability needed addressing. So just to describe the on-call system a bit more, because it's important that there's the awareness there. So of our 46 fire engines, we have 46 in total. 32 of those are actually what we call on-call fire engines. So as you can see, I mean, that's over 2/3 of the fire engines within the county are crewed using this system. We've got 24 standalone on-call stations. Well, you can see those on the map on the previous slide. But we also have 7 on-call units, which are attached to our full-time and day crewed stations as well. So in total, we actually have 31 on-call units, 24 of which stand alone at their own fire stations. And again, as you can see from the previous map, the on-call stations are found in our more rural towns and villages, where the risk there and the demand doesn't require the expense of a full-time fire station. Our on-call, also known as retained firefighters, respond from home or work at the time of an emergency, so they carry a pager. And when the control room receives that emergency calling from the public, the local station is activated, the pages go off, and our on-call firefighters respond into the station and then turn out the fire engine from that station. So when they're available, they must generally remain within about a 5-minute radius of the fire station. So you can understand that that is pretty restrictive in terms of the people we can draw from to be on-call firefighters. They do respond to the full range of incidents that every other firefighter in the country responds to. So they go to fires, rescues, chemical spills, assisting other emergency services and so on. So they do the full range of activity. And they provide a huge community service through a role that I would say is extremely rewarding, but not so much in a financial sense. And again, we recognise that we really do need to make a change in the way that we pay our on-call firefighters. Now, the existing system was originally created in the 1950s. And back then it was primarily designed around the fact that people worked and lived in their local area. So the on-call system, or the retained system as it was called then, operated pretty nicely because you could guarantee that local people would be able to respond to their local fire station and turn out that fire engine. Now, since the 1950s, that system itself has never really been modernised. So we are still working within the same parameters as it was then. But as you can imagine, that is incredibly restrictive for us. I talked about the changes in society, changes in work patterns and work status. Generally now in villages and towns, people will travel away from their home base as such to go and perform their work elsewhere, which again for us causes a significant issue in terms of how we then attract the on-call firefighters to respond to their local fire station. That's not to say there aren't other opportunities. So with the increase in agile working and home-based working, we're now looking at opportunities. Are there more people available for us in the local vicinity to be able to provide that service for us? And that's something that we're really looking at very, very closely. What we do recognise, and I mentioned it previously, is that we don't pay them in the correct way. What we tend to do, if you can imagine, some of our quieter fire stations will do maybe 40, 50, 60 calls a year, so perhaps one incident per week. And these firefighters are providing significant amounts of commitment in terms of the availability they give for, I suppose, little activity in terms of that emergency response. What we need to do going forward is look at the way that we provide reward for the commitment that they provide, rather than what it is currently. But again, these are things that we've already recognised and are looking at developing further as we move forward. So just move on to the next slide. So in terms of the on-call system opportunities, we've recently undertaken an on-call review. And within that review, we've looked at several areas, which again, nationally has been looked at. And there's certain elements that we're now looking to introduce as part of that on-call review to improve not only the way that the firefighters perform themselves, but more so about how we support them as a service to be able to perform more effectively. And as you can see on the screen there, there's several main areas that we can improve upon. So technology advances all the time. We are currently implementing a new app, which is the normal sort of app that you would get on your mobile phone, and that will allow our firefighters to more easily book available. So, for instance, if, I don't know, a tradesperson who is also an on-call firefighter needs to travel out of the local area to perform a job, currently what they would need to do is visit the local fire station, log onto a computer, book themselves unavailable for what will be maybe an hour or two, to then go away and do that job, to then come back and do the reverse procedure in terms of booking back available, but again, having to visit the fire station to do so. That is not a good use of their time, and it's not a good use of resources in general. And again, we can do better to support them in that. So we are now implementing this app, which will enable them to do that from their phone without having to travel anywhere else. And what we're hoping to achieve is then an increase in availability, because it would be easier and much more dynamic for them to book on and off. But at the same time, when that happens, it would alert all of the other firefighters in the area that the fire engine potentially has gone unavailable, and it would encourage those firefighters to then book on to make that fire engine available in lieu of the one who's booked off. So that's stuff that we're on with right now. Another area that we've recognised needs improving is that employee recognition and providing incentives back to the employers who provide the primary employment to our on-call firefighters. So we don't do enough currently to recognise the employers who release these members of staff when the pager goes off, and it goes off at a moment's notice, as you would imagine, and they run out the door. So there is and can be significant impact on those primary employers. We need to look more about producing sort of employer certificates, recognition letters, award events, an employer recognition month, publicised on social media, and again raising the profile of those primary employers within a local community and what they give to the local community. We need to strengthen our links with the local enterprise partnership. We also need to look at, is there a potential for us to use our fire stations in a different way to create business hubs from which different businesses could have some office space to be able to work from. And again, in return for that, what we would expect is then an on-call firefighter to be more readily available to us at the time of need. And we can look at other such advertising means as well, such as signage and wraps for our vehicles in support of our primary employers, because we really do recognise the true value that these employers give to us as a fire service in releasing their employees. When we look at the initial application to what we call the Safe to Ride course, this can take months. And simply put, it shouldn't take months. If we improve the processes that we've got in place currently, we should be able to reduce the recruitment process down from months to weeks. And it is from the point of application. So a person will put in an application. There's a number of tests that we subject the applicant to, including written and physical tests. And there's medicals and other such things to run through to be able to then get ready to be on a course. So we need to look more at the use of online systems instead of paper-based systems, look at our website info and what advice and information we put out there to these candidates. We very much need to look at testing across one day rather than a number of days. So again, an example of this is we will regularly take, I mentioned Bentham earlier, our furthest station in the west. For somebody to come from Bentham to Easingwold, which is where we currently undertake the majority of our testing, that's probably a 2-hour round trip at least. Well, quite often we will take that candidate and ask them to come to Easingwold over maybe 2 or 3 different occasions, which, as you can imagine, from a personal point of view, is pretty onerous. So we've got to do better with that as well and look at providing testing across one day in one location and to make that testing portable if we can. So instead of bringing the candidates to us, we should be, where we can be, taking the testing to the candidates to reduce that burden down upon them. So we are looking at the whole entire process from start to finish and how we can refine that and make it much more slick. Same with training courses, the portability of training courses. We can take them out into the districts, out into the places where they're needed, rather than bringing people to us. And in terms of development and competency, we expect our on-call firefighters to go through the same routes of development and competency that we do our full-time firefighters. But again, we've looked at that in terms of how user-friendly that process is. And we're making tweaks to that to make it more user-friendly to the actual person trying to achieve that development and competency itself. And then finally, like I said, we do need to look at paying contracts as we go forward. There are a number of fire services in the country have already done this quite some time ago. There's new ideas being generated all of the time across other fire services, and it's something that we'd like to consider going forward as well. All that said, going back to that initial slide, I did say that one of our challenges is funding. It is the finances. And of course, none of this comes at a cheap cost. So it's something that we've got to factor into that going forward in terms of its affordability. And then finally, in terms of how we might want to deliver this in terms of the timescales, like I said, currently, the technological improvements we are working on right now, similarly with the recruitment and the development of competency and the employer engagement, we're making a start with that now. But those aspects will take a little while longer to implement in full. So we're looking more at the medium term for that, so into year 2. And then longer term, 3 years plus, if we were to look at introducing a review of paying conditions, then, realistically speaking, we are looking more long term at that prospect over sort of like 3, maybe more years to look at that. But of course, those solutions to the on-call, not one of them alone will solve the issues that we've got. We've got to look at it in the round and look at introducing as many of these improvements as we can do. But that's really only part of the story in terms of how we provide our services better to the public of North Yorkshire. Because as I said at the beginning, we do need to look at the way that we provide our prevention and protection, which is in effect is our business fire safety. And again, we are looking at that and reviewing the way that we do that. So, for instance, where we have our extended response times, we need to look at how we provide a better prevention service in those areas. So at this point, I was going to hand over to Dave, who's going to talk in more detail around the current prevention activity that takes place from us within the service and some of the developments that we're looking at putting into place as we go forward. So over to you, Dave, and I'll keep flicking through the slides for you.
Okay, thanks, Phil. So really just to start off and set a bit of background and context here, the way that we've approached the delivery of prevention services on behalf of North Yorkshire Fire Service is based on what we've classed or called our pillars of prevention. So you can see this slide here really tries to illustrate that the 7 areas that we focus on in our prevention service are there to support, as Phil mentioned, the care, which is sort of based on what our internal service strategies are aiming to try and achieve. So the 7 pillars, as we call them, are based on 3 to do with types of environments, so domestic setting, so people's homes, road safety and water safety. Early intervention is really the area of work that we're focused largely now with our youth activity work, but it spills out wider than that, about trying to get in early and stop things. I'm going to cover that in a bit more detail in a moment. The box that says disruption is actually there to very deliberately introduce some new language into the fire service about how we can get in early and disrupt or stop things escalating. And we've used that really as a word that's taken from some of our work with actually North Yorkshire Police. The fire service now working closely with some boards and panels within a partnership environment, such as serious organised crime and the groups that fill out from that, like Prevent, like modern day slavery, like the disruption panel itself. So that's really about how, as a fire service, we are wanting to engage in partnerships and work collaboratively with other organisations, both the public, maybe the private and the third sector, in delivering our prevention services. Safeguarding is a standalone pillar in its own right. We've covered that in a previous PAM, but safeguarding is now increasingly becoming more prominent within our service as to how we deliver or respond to those people in our communities who are at risk of or are being exposed to abuse or harm, including self-abuse and self-harm. And then we have a pillar about communication, which is really how do we effectively engage with and communicate our safety messages and our pieces of work to the community in its broadest sense. I mentioned early intervention, and this is really quite important. Can you move on, Phil, to the next slide, please? Within North Yorkshire, over the last couple of years, we've been very focused now on trying to shift the emphasis of our prevention services away from what's called tertiary prevention or tertiary intervention, and following what's classed as or called a public health model. This is really about moving things much more upstream to identify what are, in effect, called the risk factors that put people likely to be in need of acute services from organisations like fire and indeed police and other local authorities. And it's a really well-developed model. It's something that we're now using very much to sort of shape our prevention toolkits and about what we do, and the training we're providing with our staff is about putting that in place so that people can start to identify what puts people at risk before it actually starts to happen. And in between, we have what's called secondary. So this is where things are starting to appear and start to materialise, where we can get involved and try to nip things in the bud. And in essence, what you try to do with this particular model is understand the risk factors and reduce those by removing them, or if you can't remove them, you introduce what are called protection factors to try and help individuals, communities, groups to actually put things in place to reduce the impact of that risk on them. So we're really quite excited about this approach. It's starting to get some real traction. We're starting to see a much better understanding of it. And it's a really common language in the partnership landscape. A lot of organisations now are very much moving in this direction. So I feel we're very much on the same page as a lot of the people that we're now working with in partnership and collaboration, particularly when we deliver our prevention services. And I think we have spent a lot of time in partnerships over many, many years. The role that the fire service is playing is becoming increasingly important, not just in taking away work, but actually contributing to the effectiveness of how partnerships operate. And we are starting to spread our wings and get involved in a more diverse number of partnerships where we can bring our expertise, knowledge, resource into those partnerships and facilitate some really good conversations about how we can do what I talked about in terms of early intervention. On the slide previous to this one, what I just wanted to mention is that, and Phil's talked about it briefly, we are currently in the process of producing our new risk resource model. And the risk resource model is predicated or based on a detailed community risk profile. So the work that we've done to date has given us a much clearer understanding of what risk looks like in our service area, in our community. And the question that's been asked of us today is really about how are we delivering our services to the rural communities, and it's fair to say that that is very challenging for some of the reasons that Phil's already set out. But just to be clear, when we talk about what does rural mean, we look at it as really a geographic area that's located outside of larger towns and cities. And it's often sort of characterised by sparser populations. And when we look at the county as a whole, it's probably fair to say that it is a rural county interspersed with areas of urban population. But our staffing model in fire, for the reasons Phil set out earlier, has been predominantly weighted to providing a response model of staffing against the areas of higher population density. And that staffing model creates as a challenge in how do we allow or create the opportunity for our staff to actually go into those more rural communities and deliver the wider range of services that we are responsible for delivering and want to deliver. So really about taking that risk profile and effectively linking our service provision to those communities where we want to put it in place. So one of the things that we are really focused on is how do we build the links with those communities? How do we understand who's already operating in those communities, and how do we work smartly with them in partnership to actually connect with people? And one of the things that we learned over the last 18 months, certainly in 2020 through the pandemic in its early stages and the lockdowns, was how effective we can be working closely with other agencies to deliver our services, and in particular working with the upper tier authorities like the County Council, using their data to feed us information about who to go and talk to, and then us putting our physical resources, our staffing resource, into targeted intervention, which did work really well. So it's a model that we're wanting now to very much build on and take forward to make sure that we can use that learning to much better effect going forward. Just bear with me. I think, I've got a battery problem. Sorry. It is currently, though, very challenging, and Phil's talked about some of the much bigger work that's been undertaken by fire, and we're looking to the risk resource model to look at how we can be creative and innovative about creating space, opportunity, resource, assets to deliver that work. So it's not an immediate fix, and it's going to take a lot of considered thought to actually resolve and deliver it the way we want to. But we are very focused and very aspirational about what we want to achieve going forward, and very committed to making sure that we do put the right intervention, the right prevention into the place to target those risk factors. And then we're looking at an appropriate way of evaluating that. So looking at the outcomes from our intervention work, and looking at, you know, how do we measure the impact that we've had on making communities safer. Phil, could you just move on to the next slide? And that's where you need to try to get this to work. So we're just going to introduce a short video here, which basically just illustrates how we work with other agencies in delivering some of our prevention services. It's about 4 or 5 minutes long. It's not a long video, but it just gives a flavour of some of the work we do, particularly around domestic safety.
Okay, you're really testing me now. Let me see if I can share this then. I'm not sure if the volume will come through. Let's just give it a go.
Should be a little tick box.
Sorry, Tom, can you say that again?
There should be a little checkbox when you're looking at the share panel, which says share computer audio.
Okay, let's just give this a go then. Shall I just give it a? Can you? Has that come up on screen? The actual video.
Yes.
Play.
And there's no audio, is there yet?
There's no audio, no.
Okay, let me just try this then. I'm struggling here. So share audio where, Tom? Sorry about this.
So you'll need to unshare.
Yeah.
And then when you open the share panel, at the top there should be a little button which says include computer sound.
I've got it, but it says when I click that, it says can't share sound. So I think we should just probably move on at this point. If I can get it to work, I'll let you know. But currently, it's not letting me do that. So
don't worry about it.
Okay.
But in effect,
I think that's going to be quite challenging to get that to work, isn't it? But it was worth a try. Dave, could you summarise what the video would have said to the viewers and to colleagues in the virtual meeting?
Safe and well visit at fire safety in people's homes, checking they've got adequate smoke detection, as well as conducting a well-being check to make sure that they're managing well in their own environment and providing any help we can. The alerters went in quite late at night. We responded to the station. Our tip sheet indicated that it was a property fire located in the kitchen. A 2-point response. Both of our appliances attended. Watch manager went to investigate. Returned shortly afterwards, indicating the property was severely hoarded, the fire was out, and that he'd like me as community safety officer to go and conduct a safe and well visit with the occupant. Upon entering the property, I discovered that the property was severely hoarded, evidence of human waste, washing up, piles of old newspapers and such, covering just about every available surface, including adjacent to the oven, which is what caused the fire initially. Spoke with the occupant and had a quick chat just to get to know him a bit. After submitting our safeguarding referral, I was able to return with a joint visit to the property with Helen from Living Well. I specifically wanted to go with Living Well because I thought there'd be a more gentle introduction to receiving help in the home and not going straight to a social care assessment. I felt as he rejected help in the past, it would be unlikely to engage with a social worker, so Living Well seemed the best way to go.
We receive referrals via our customer service centre, and I was asked to do a joint visit with Nick, community support officer in Skipton, and we arranged to meet one Friday evening, which I was quite glad about because the gentleman's house was really difficult to find. He lived down a really long lane, and everything about the house is very overgrown. I would have never found it if I hadn't have met Nick. We pulled on the assets that were surrounding him. Neighbours had already alerted the fire service that they thought there was issues with the property. So he didn't have any cooking facilities, so they provided him with a kettle so he could make hot drinks over the weekend and agreed to microwave food for him. We then made a referral to the Age UK, so on Monday we'd start receiving a lunchtime meal each day until we had the time to replace the oven. People can sometimes disappear into society. You can have a neighbour and you can feel that they're managing well, and sometimes you miss out on little triggers that are saying that they need some support. When you work cohesively, it's really important. It means that people get the right support. So on this occasion, he got the knowledge of the fire officer. He was able to provide us with the safety measurements that needed to put in place. Wasn't aware of the community support available. We've actually put him in touch with a community shopping programme and most importantly Age UK.
During the pandemic, Age UK set up a Meals on Wheels project, and this is delivering hot meals to older people who are isolated, vulnerable, or who would benefit from a hot meal. We received a referral from social services, and this was for a male who had experienced a domestic fire in his home. Through our collaboration with North Yorkshire Fire and Rescue and the Living Well team, the individual has now grown in confidence and visits our community cafe weekly, where he can access wider support services. Really important we have our community cafe for individuals who may be isolated or who have been shielding for a significant period of time during the pandemic, and we give them the opportunity to come out of their homes in a safe environment. We work very closely with a multitude of similar organisations, including Adult Social Services and Living Well team.
The day that he had his cooker delivered, he was like a totally different gentleman. He had a big smile on his face and he'd made himself a pot of rice for lunch. And he was really proud about that, yeah. And he's really proud about his kitchen, and now he's so keen to make improvements. When everyone comes together, I think, it is really rewarding, and it's rewarding when you see someone and see their outlook has changed and they're accessing community. Community support's great, and it's great when people access it. That's what it's there for, and sometimes people are scared to do that. It's like they feel that they're failing when they're not accessing support, but they're not. It's there to access. And when they do, it makes a huge difference.
Our gentleman has certainly become more receptive to help as we've progressed with him. I think he's seen the benefits of allowing people to come into his home and help him out. He's gone from being a character who feels like he has to kind of struggle through on his own and just manage the best he can, to someone who realises he can't do everything by himself anymore and needs to allow professionals to come in and help him through life as he gets older and requires a bit more support.
Dave, thank you for that. I'm glad we managed to get it working. I think it's very, very well worth seeing that firsthand. I'm sure you would have done a sterling job of summarising it, but it was very good to see the video.
Oh, thank you, Simon. I'm really pleased it showed as well, because I think there's a couple of key messages that come out of that clip. One is that sometimes we become aware of a situation or a person that needs help because of an adverse event like a fire. What we're really trying to understand more is who are those people before that event happens. And the comments that were made in there about sometimes, you've got neighbours, people that you just assume are okay and that they're maybe not. But there are an awful lot of interactions in communities, particularly with volunteer groups who are meeting with people. And what we're wanting to do is build on the learning from the lockdown and the COVID experience and using those groups much better. So we're working now through some with certainly North Yorkshire County Council and the upper tier authorities about working with new groups like thriving communities and with supporting communities. So we're really excited about the opportunities. I hope that will throw up for us. And the other point to mention is that, yes, we started the ball rolling. We dealt with the immediate issue around fire, but you can see from that one how quickly it spread to other types of support. So whilst we want referrals in, it's very much about us taking a lead to connect individuals with other services that then can provide longer term support. And if we can keep the sustained involvement, we will do. But it's about trying to make sure that as a community, we are looking after the most at risk. So I think that short video clip really illustrates some key messages that that we wanted to get across today. And just to round off, really, I talked about the importance of partnerships and collaboration. We've got some very long-standing, very mature relationships with some big organisations, and it's about making sure that we're using that relationship to best effect. So we are regularly talking, sharing, listening, thinking about how we can do things better and smarter using limited resources, but in a more creative way. We've got things that we're trialling. I won't go into much detail now, but we are looking at ways that we can use like public safety service and linking with that with new technology and putting things in place and connecting people up using smart places and what's called the Internet of Things, just to try to link people to ways of having some passive support. So it's all really quite exciting. It can be really quite creative. I think really we know that we've got some challenges in how we deliver stuff, but we are very focused on trying to step up to that challenge. And going forward, our commitment is that we want to make sure we deliver our prevention services as fully and fairly and properly as we can right across the service area, and not losing sight of the rural nature of North Yorkshire. So I'll finish there, Simon, if that's okay.
Thank you. Thanks, Dave. Thanks, Phil. So can I just open up to colleagues in the meeting for questions in relation to the totality of the presentation? Caroline, you're first.
Thanks, Simon. Yeah, thanks, Phil and Dave. Great presentation. Just to sort of take us back to the beginning, I was quite curious from a fire service perspective how you define rural, if we're looking at those rural communities. And is there anything in terms of the incidents and the risks within the rural, that's more prevalent in those communities?
I'll go first if you like, Phil.
Thanks.
So I give you a very simple definition of what rurality means to us. It's basically those areas that are away from our built-up towns and cities. Obviously, we have communities that live in rural, so villages, hamlets, and smaller communities. But it's generally those areas where we've got the more sparsely or lower densities of population is how we're looking at it. But as a county, we're geographically the biggest in the country, as you know. And some of the risks that I talked about, our prevention pillars, are aimed at some risks that are not reflective of where people actually reside. So we obviously looking at road and water related risk. Now we've got a fairly extensive transport network, not just road, but obviously rail, canal, a whole range of different networks across our service area. And they obviously go and move between the urban environment, tracking through the rural communities, but we might have a motorway that goes through a rural community, or we might have a village lane that goes through the same space as well. And this is where it's important that we understand what the risk is, but also how we work with other agencies to address that problem. The fire service can't own all the risk and resolve all the risk, which is why we work in partnership around road safety. So we have the road safety, the North Yorkshire and York Road Safety Partnership. We work closely with other agencies involved with water, so Yorkshire Water particularly, and some of the major landowners who have got some of the significant risks on their estate. And the way we're trying to approach that is to join up and give out joint safety messages. But we feel that's really important that we connect with those agencies and it becomes a combined joint message that goes out. So we can try and cover things across the whole service area, addressing the sort of the big broad brush rural issues that we face in North Yorkshire. And again, some of those are seasonal. So we do work around preventing things like moorland fires. We've been very successful in this county. I'm touching wood here, but for the last 5 or 6 years, we've had very, very few significant fires on the upland and moorland, and that's largely because of the work we do with the landowners and the people that are responsible for managing that space. So they do it responsibly, and they do it because we engage with them, before they start doing the burning off, for example, and that's resulted in us not seeing large wildfires in predominantly a very likely, you go on the moors and the dales and you can see this space, but we're not troubled by it. So I hope that answers your question, Caroline.
Thank you. Yes, thanks, Dave.
Thank you, Caroline. Thanks, Dave. Jenny Newbury, you were next.
Thank you. It takes us back to the beginning of the presentation. I'm interested if there's more you can share with the public around response time impact across the 4 areas that you talked about. So there's maximum, optimum, minimum and critical. What impact does it have in relation to those 4 areas on response times?
So in terms of impact, I'll take this one, Jenny. Yeah, like I said previously, we will try and reduce that impact as far as possible. So where we have gaps opening up, we will always try and close those gaps by repositioning fire engines. And it is an approach that we take where we get the larger incidents occurring. Even if we had all 46 fire engines available, for instance, when we get a large incident occurring, we will start to move our resources around the county to again reduce that impact down. So invariably, if you take a resource out, then obviously the response times will increase because you've got to take the next neighbouring resource to travel across probably the one that is unavailable to get to where the actual incident is occurring. So we do recognise that there is the impact, but we take a risk assessed approach on a daily basis, and it is a dynamic process as well. So not only do we just consider that, at the change of shift morning and night to see what the resources look like, as those resources change throughout the 24-hour period, we are dynamically moving stuff around to make sure that we are again assessing that risk and mitigating it as far as possible. Well, one thing I didn't mention actually from an on-call point of view, and I'm just going to jump in and take the opportunity here, is to say a massive thank you actually to our on-call staff, because of the commitment, I mentioned it earlier, their commitment to providing the service that I provide is absolutely admirable. And I probably painted a bit of a bleak picture in terms of the availability, because that is reality. But what I didn't do in the same breath is really just applaud those firefighters that we have in place who provide that amount of availability to keep our fire engines running. And of course, along with that, I did talk about the paying conditions side of things. Well, that's not everything either, is it, in terms of the reward and the reason that our on-call firefighters do the job that they do. There's many other benefits from a personal point of view that they will achieve through being on call. So there's that teamwork element. There's the actual give back to the community that they provide. That real value and contribution back to the community. We provide them with a range of new skills that again they can take away and use in other areas as well. So I just wanted to jump in there and grab the opportunity to say a big thumbs up to those that we've got, and actually a plea to the wider community, to the public, to come and join us. We do pay our firefighters, by the way, but what I'm saying is we probably need to be doing that better, or there's a better way to do that in future. But big thumbs up. Sorry, Jenny. Did that initially answer your question in terms of impact, Jenny?
It does, thank you.
Thank you.
Thanks both. So going in the order on my screen, I think, Tom, you're next.
Thanks, Simon. A couple of questions, if I may. The first one, Phil, thank you very much. In terms of what you set out, in terms of the changes that you're proposing to the on-call service, that obviously it's great. I just wondered whether you could say a bit more about the learning that's been taken from other services around the country in putting those proposals together, and how that's progressing, please.
Yeah, certainly, Tom. The recent on-call review that we undertook did look at other fire services across the nation, and previous reviews that we've done, so one back in 2015 and then thinking back to one back in 2009, we always look across other services for that best practice. So there's one particular service who's got a new way of providing paying conditions, which is radically different from another, and we're looking at that one with interest. But equally, we didn't look at that one in isolation. We considered it against some other models that are in place across the country. Like I said before, Tom, there's not one fire service in the country who's sorted the problem out. It is a range of solutions that is required to be able to improve the service as a whole from an on-call perspective. So undoubtedly there are areas of best practice across the country which we have looked across, but we continue to look as well. So part of my role as Director of Transformation is to put in some of these changes. So again, what's in our on-call review now is absolutely sound, but it does not prevent me keeping an ear to the ground and looking at best practice as we develop, and implement the changes going forward. So, yeah, we don't have all the answers in North Yorkshire. We know that. Equally, nobody else does. But together, I think that there are the solutions there.
No, it's good that it's a best practice approach. It's always a positive. And the other question then, Dave, you spoke about that attempt to get really upstream, and obviously you talked about neighbours helping each other, and I guess the kind of epitome of that is the effort to build resilience in communities so that they can actually help themselves, and I just wondered if you could say a bit about what if the service is doing anything to help kind of build that resilience in communities for themselves to help each other beyond you spoke quite a bit about the service-led prevention, I guess, is what I'm saying there. And I just wondered whether there was more that you were doing to help communities help themselves instead.
Yeah, sure, Tom. So starting from a sort of more strategic level, we're involved in conversations around sort of thriving or connecting communities. And following out from that, that's where you see the networks of volunteer groups and people who are, embedded in communities at a very localized level, sort of place-based level. And it's about tapping in with those individuals to basically sort of share with them what we mean by resilience. How can we support them in helping themselves, isn't it, in effect? So there is information that we're sort of like putting back towards the sort of more strategic group, which is filtering down. What we're really focused on at the moment is getting more localized interactions between our managers, so station group managers, with the local networks, the local links to be sort of like really strengthened. And we've got a plan, a piece of work that we're working through now with well, the next couple of weeks, we're going to have a new group of managers coming into service because we've got a round of promotions and we're wanting to make sure they fully understand the role that they play in this, about, really getting in, meeting, networking, and what do we mean by resilience and things. Part of it is around looking at individuals, but we can also take that further and look at some of the pre-planning arrangements. So we know we have issues around flooding. And what we want to do is, pardon the pun here, but get really upstream. So we're not waiting for the rain to come and it to flood. We want to get in there and start preparing, moving people who might be at risk of flooding before it happens. And even if that requires putting resources in to assist with that, then that's where we need to be heading. It's also, I talked about new technology, Tom, and I talked about some of the really innovative things. We are involved in a sort of trailblazer project about trying to bring in the use of technology and our links with working with people who, for example, through the Safe and Well work we do, about how we can use passive monitoring sensory devices that link to something that alerts another individual. And this is something that's going on with the public safety officers in Grassington and Bentham currently. We're hoping it's going to show that we can actually then link that to localized support, even if it tracks through to formal care arrangements in the community, where if somebody has an issue, it alerts them and then there is a level of response back. And that might even include a response call to a blue light service like ourselves to say something's gone off, like a smoke detector, in a person's home who is known to be very vulnerable, and it might prompt a call. So it's about really using the new technology, but using our staff to engage with those communities, representative groups and the individuals to put things in place to strengthen and improve that resilience, and hopefully therefore to make people not just feel safer but be safer. So hopefully that answers your question, Tom.
Yeah, I think there was still a fair bit of focus there on kind of service-led prevention, but I take the points that you made. I guess the question then is, if we've identified kind of white areas, if you like, where there is a lack of crossover in terms of response, and you're talking there about a focus in terms of putting the resource in to help build that resilience. Do you think that you've got enough capacity, enough resource to be able to do that properly?
Well, like I said, we've got the challenges sort of like moving from a traditional staffing model, but I think it's about working smarter. So some of these conversations are about helping the community to help themselves. Mm-hmm. So one manager, understanding what they can go and do on our behalf and having those really proactive, constructive conversations with community leaders and community groups is obviously a really strong starting point. Now, that I don't think is particularly resource heavy because it is about one person linking in. What comes out the other end of that conversation in terms of how do we support it, it could be something that we have to look very carefully about how do we resource that. But we're very focused on making sure that we get this started and that we are having as much involvement, engagement as we can in the way that I've described.
Thank you.
Thanks both. And John Foster. Sorry, John, can I just, sorry to interrupt. I don't know whether I'm alone in relation to this, but I'm afraid I can't hear you at all.
Okay, can you hear me now?
It's a little bit better, yes.
Okay, so I'll keep this brief, Simon. The point I wanted to raise was the role of the on-call firefighter, we've explained some challenges. Phil's quite eloquently put forward. It really is an exciting opportunity for people to come forward. And it would be remiss this afternoon to put this to the public without saying, please, if you know people who may be interested in becoming an on-call firefighter, then please come forward. It's a really rewarding opportunity, some real career opportunities there, and it builds your skill sets as well. So on that, it's not just open to men. We employ a wide and diverse workforce. So we would really encourage people to come forward, boys, girls, men, women. We operate from 18 years upwards. We've got people 60 plus years. So please, if you know people who would like to join, would be interested in joining, go to your local fire station, look at the website, or even approach the Commissioner's office, and we will be able to help out with your inquiry. But we really do need the community to step forward to make our to improve the situation. So we welcome people to come forward. Thank you.
John, thank you very much. I'm going to suggest that in relation to the support services to help communities to help themselves, and also in relation to the information that aspiring on-call firefighters might need, if we could arrange to publish hyperlinks to all of those materials when we publish the meeting and the slide packs, then that will allow members of the public who are interested in finding out more about any of those aspects of matters that we've discussed and highlighted to do so for themselves. So thank you, everybody, for the presentation in relation to those important themes. That takes us on just marginally behind schedule to the overall performance update in relation to North Yorkshire Fire and Rescue Service. And I'd like to, if possible, just to recover a little bit of the small amount of lost time. So Dave, I think we're with you, and the challenge to you is if you could deliver your presentation and field questions within 15 minutes rather than 20 minutes to recover the time, please. But we'll see how we go.
Has that come up on your screen, Simon?
It has indeed.
It has. Okay, so I shall endeavour to do your request. So this is the performance pack update on behalf of North Yorkshire for September. You can see we're reporting on the last quarter, so what we refer to as quarter two. Just make that move. Okay. So a fairly standard format to what we've presented previously, Simon. Here we look at the incident overview. What we're seeing here is, some variation in the call profile month by month. You can see we've seen a reduction of circa 60 calls between July through to September this year. The breakdown again looks fairly prorated, quite similar between our false alarms, fires and special service calls. The interesting point here is that we are still looking at a significant number of false alarm calls for service. I'll expand on that a little bit in a future slide. It's worth, just for the benefits of the public, understanding what we mean by special service. It's a broad brush term. Again, I'll expand on that a little bit later on. But as a fire and rescue service, we do attend a wide range of incidents that we're expected to deal with and resource for, train for. But you'll see there that special service calls actually outnumber the number of fires we go to quite significantly month by month. In terms of the year breakdown, you can see here again, we're sort of operating at a relatively similar number to what we had in 2019. The anomaly obviously is 2020, which was the year of the pandemic largely. So if we're just taking that as an exception, I think we're kind of now going back to a relatively normal state. But there is actually a reduction there of around about 100 calls on that particular quarter. So tracking that through, that's quite a reasonable number if we extrapolate that across for a year. we're sort of starting to see a downward trend in numbers of calls that we attend, and we'll keep an eye on that. If I move on to the next slide. So in terms of special service calls, this is just an example of some of the information that we take from our what's called incident reporting system. But special service calls for us include things like our attendance at road traffic collisions, but they also track through to animal rescue, water rescue, flooding, lift rescue. So it's a really broad brush term that we have. One of the areas that we're starting to see a growth is where you can see what's called assisting other agencies, non-emergency, and gaining entry. This is something that we're actively monitoring and looking at now, because we're starting to see an increase in number of occasions where we're asked to assist other services, either gain entry or indeed help with body recovery. So our staff are now becoming more regularly involved in incidents where they've got to assist, certainly the ambulance service, where people have sadly deceased and in their home environment. So it's just something that we're seeing an upward trend in, and we're obviously just monitoring that, and that means that we're looking at that from a point of view of the arrangements we have in place for our staff when they're attending such incidents. False alarm and automatic fire alarm rates. As you can see here, this is a slide showing month by month. They vary on a month by month basis. We've seen an upward trend certainly since April, which really reflects when we started to see some changes to the lockdown and businesses starting to reopen earlier this year fully. And changes to how buildings are being used, certainly the commercial premises. So we've seen a gradual return back to what we might have seen as like more normal levels. And then actually, interestingly, as we came through September, we've seen a small decline there as well. So it's something that we are very focused on. It's a national issue. The attendance at false alarms by fire service is something that we've been focused on trying to reduce, and we are doing a number of things. First of all, understanding the profile breakdown. You can see here we have quite a number that are down to false alarm apparatus, the largest number of activations. What's very pertinent to share with you, though, is a lot of the calls that we get are what I might describe as one-offs. So whilst we do have a number of premises that we go to regularly, quite often it is a call that might be just the first and only time we attend a premises. And it can be down to something like a fault on the system, or it can be down to a good intent, or indeed a malicious activation. Now, what we're looking here is how can we start to use that to help us with some of our other work. I've just talked at length about some of our prevention services, and obviously we're trying to link that now to an offer of, if we go to in the domestic environment, can we link it to Safe and Well? And as we've just brought in our new training team for protection as part of the Uplift grant, we're looking at how we can educate staff to do fire safety checks and feed in some work around the fire safety measures in buildings that are commercial when we attend a fire signal. So we are looking at the response to false alarm activations, but we're also looking at what we can do better when we actually go, and how we can like feed that into our protection and prevention services. The
Dave, thanks. Sorry to interrupt. I think Tom wants to come in on this topic with a question.
Yeah, okay. Sorry, Dave. You touched on what I was going to ask there, but didn't quite ask. So you talked there about the repeat aspects and the work you've been doing to bring down the response to false the false alarms side of things. Do you what isn't on the slides, and I don't think is on the next slide either, is what proportion of the false alarms are those repeat ones that you just mentioned, and also which ones fall outside of what of those that of the acceptable what is acceptable in terms of the policy that North Yorkshire Fire and Rescue hold?
Yeah, so I don't have an exact percentage figure to share with you right now. What you're talking about, Tom, is when we look at what we class as repeat offenders, or where we have like a regular attendance, our triggers for that are any activation twice a month, or any 6 occasions in any rolling 12-month period. So they are the 2 triggers where we start then talking about, a repeat attendance. And we've just reviewed our internal policy and arrangements about how we respond to that, so that we can better monitor it. But also it's about who's having the conversations with that organisation in terms of what do they need to do. So we do have, we've revised and renewed our letters of communication, but also it's now maybe more of our fire safety officers who will be engaging those conversations with what's classed as a responsible person, the person who owns the building, but that also looks at the arrangements that they've got. So we can introduce things like a double knock system, which basically means it needs 2 detectors to activate, or we might introduce something like a delayed response. So they get a window of time, quite short admittedly, but to go and investigate and say, is it actually a genuine issue, or can they just cancel the alarm? And you have to remember that the alarm systems are largely put in buildings to alert the residents. The challenge we've got is that quite a lot of those systems link through what's called an ARC, an automatic response centre, to our control rooms. So again, there's some work being done internally about our call challenge. So our control staff, asking the question of the ARC about, is this a genuine fire? Have you investigated it? So there is a sort of hierarchy of interventions, and we're really focused now on making sure that policy I talk about is being adhered to properly. But what I was just about to go on to say, Tom, is that within the transformation project, we are going to be looking in more depth at a range of wider options around the management of what we're classing as unwanted fire signals. Now, that's a piece of work that's just been launched, so I'm not going to go into what that might contain right now, but it is an active piece of work that we're going to be looking very carefully at. Your question that you asked of Phil, and your comment about best practice, looking nationally at what other services do in their response arrangements or managing of unwanted fire signals. And obviously there are a number of different arrangements in the nation about how they do that. Scotland, for example, are currently in the midst of a national consultation exercise on their arrangement. So we're looking very wide, and we're talking to the services about how they've managed it and what's the really good lessons that they've learned, the best practice to then consider introducing into North Yorkshire. Okay. I'll just try to move on.
Yeah,
Simon.
So yeah, you might want to just focus on exceptions, really, bearing in mind the
absence levels, the slide there, obviously it's shown to show where are some significant punctuation points over the last 18 months. You can see those there. What I would share with you is that we are now looking very much in depth at absenteeism due to sickness. We're getting much more better quality information coming through from Enable about how to break down the sickness profile. In terms of long-term sickness, the main thing that we see has been a contributor to that is musculoskeletal, but we are seeing a number of areas around anxiety and depression and mental health, and so we're obviously working very much with our colleagues in Enable to understand that and the wellbeing provision that can be put in place to help people who are off with that. When it comes to short-term sickness, things like gastrointestinal problems, but interestingly, we've seen quite a number of staff that have had short-term absence in response to the COVID vaccination programme. So something that we perhaps weren't experiencing 18 months ago in the past has come along, but hopefully that will sort of phase itself out as well as people have had the vaccine and it becomes something that we've had a spike and gone down. So Phil has, I suppose, really given you a good overview of fire cover. This slide really captures the Q2 profile. Really, it's kind of steady state through Q2. And if we compare back over the last 3 years, a very sort of small decline in terms of our fire cover arrangements. There has been in this last quarter growth in what we call the risk critical. So going back to Phil's presentation where he put up the 4 areas, you can see we've had maybe an increase in a small increase in the number of occasions where we're hitting that level. And so Phil's talked about the arrangements we put in place to cover that. Again, the availability profile of our on-call stations, we track that very regularly. Again, you can sort of see through the quarter, pretty steady state again, around about the sort of 75% mark.
So Dave, just on that, sorry, I know I'm threatening the timescale slightly by asking this question, but just to perhaps reiterate some of the points that we made earlier on, if you could just take that opportunity in relation to availability, because those figures appear perhaps to members of the public to be rather alarmingly low in terms of availability. So in plain terms, what is done to plug the gap?
So what this perhaps doesn't show is this is taken for when the individual station is off the run. Then we have arrangements, so we have what's called an on-call staffing reserve. So we have individuals who we can move into a station and they boost the numbers. We have the ability to move some of our staff who might have gone on duty at a whole-time station. And if the numbers allow, we can do what we call a detached duty. So they go to the station and again do the same thing. They boost the numbers on that station. We have the opportunity for bringing in, on occasion, some of our officers, some of our watch officers who are in specialist posts like fire safety might be in a position to support those stations as well. So a number of very localised options that we put in on a daily basis to actually move the numbers up and down. Our issue and concern is that this is what we see happening for the particular station. So John's comments about the on-call and the recruitment is really important. We're very actively trying to make sure that we have a longer-term approach to recruitment and indeed retention. So we understand why people might want to step away from the on-call, and we're looking at how we can support people if it's just a short-term thing that needs to be put in place to give people some space. So, it's a very, very acute area of concern for us, something that we're doing a lot of thinking about. Phil's touched on it in terms of the transformation project. But we do have a mechanism that we apply, in our what are called our tactical officers and senior officers, about how do we move resources around to make sure that the gaps don't appear. We actually put the resources in to give the even spread of cover. So if I can assure the public, we don't leave you devoid of fire cover. We make the necessary arrangements to cover the service based on the resources we've got and where we see the risk being. So hopefully that answers your question, Simon.
Yes, it does. I mean, there's a whole series of questions that might flow on from that, I suppose. Sure, but time's a little bit of a factor for us. John, did you want to come in on this topic? I'm sorry, audio's another problem again, I'm afraid.
Yeah, can you hear me now?
Yeah.
Yeah. So just very briefly, another positive is that we have got an on-call recruits course starting within the next fortnight, and there are 16 new recruits on that course. So we're actively progressing as quick as we can the recruitment campaigns that we've got live at the moment, which will help support longer term these issues.
Yeah, thank you. I mean, I suspect in various different ways it's an issue that we'll continue to return to, isn't it? Because it is a central issue for us in terms of the reliance on the on-call model, and all of the issues that we've talked about today come to bear in relation to that. So, Dave, I'm going to guillotine you at about 1 minute from now, if that's all right. If you could just take us through the remainder of the presentation.
Yeah. So the last 2 slides really are an overview of our prevention and protection work. So in summary, what I'd like to share with you, Simon, is that we are now seeing a return to our pre-pandemic levels of delivery. And we're very focused now on making sure that our staff have got the right resources. So in terms of protection, which is the fire safety work we undertake, we are now back into our what's called risk-based inspection programme, going into businesses, auditing and fulfilling our statutory and regulatory function, but not losing sight of the benefits of engaging with the public and giving good advice and support. And with regards to prevention, again, we've seen a return back to more normal types of work, particularly around our safe and well. And we're now looking to provide further support and training in a wider range of areas of focus and interest, making sure that staff have much wider awareness. So that covers things like we've done a suite of training around domestic abuse, around prevent, hate crime. So we're raising the awareness of our staff within inside service so that they can actually look at some of the wider issues. And that takes me right back to how we're working with other organisations in sharing and responding and delivering. So I'm going to take your call and say thank you very much.
Thank you. And it's these are important presentations, and I don't mean to artificially limit them, but if we don't keep sort of broadly to time, it's very difficult for members of the public who watch back to find the right slots in the presentations. So we want to reach the widest possible audience and achieve that balance. Very, very grateful for that. Thank you. Before we move on, are there any other questions that the colleagues want to put on fire and rescue service topics? I take it not. Thanks very much, colleagues, for all of that. We're moving on to matters North Yorkshire Police now, starting with the presentation on training within North Yorkshire Police to come from Mike Walker. So I'm handing over to you, Mike.
Thank you, Simon, and good afternoon, everybody. I'll just pull the presentation up. Okay, hopefully, can you see that so far?
Yes, that seems to be working perfectly.
Excellent. Okay, so the presentation I'm going to give today is on operational training. What I'm going to look to do is give a broad overview of the operational training portfolio, but also focus mainly on the Police Educational Qualification Framework, or PEQF, within North Yorkshire Police. So that will enable, hopefully, a better explanation of the new entry routes and qualification framework for policing. In terms of operational training, just to give a bit of context, operational training forms part of the training planning and logistics portfolio, which I am the head of function of. In September 2020, we had an organisational restructure in terms of training, as it used to sit with People Services, and now it sits under the Assistant Chief Constable for Operations. It was previously called Learning and Development. It's now called Operational Training. There's still some organisational activity ongoing to look at reviewing and stabilising the organisational structure within operational training, and that is ongoing now. So in terms of the overall portfolio, the initial training programmes is one of the biggest ones under operational training, under the Police Educational Qualification Framework, and under that PEQF, we have the Police Constable Degree Apprenticeship, or PCDA, the Degree Holders Entry Programme, or DHEP, and covering all of that is the National Police Promotions Framework, or NPPF. So also under the portfolio, within looking after the new recruits police officers, is the Professional Development Unit, or the PDU. And I'll go into further detail within the presentation into how that's developed and how it looks now. We also, under operational training, cover officer safety training, or OST. So that's essentially the training that we give to all new recruits and continually throughout police officers' career to look at restraint techniques, handcuffing, and other safety techniques. We also have driver training underneath the operational training portfolio, and I'll go into a little bit more detail around that later on. We also have tactical training support. Now, I appreciate there's quite a lot of training and definitions we have here, and tactical training in simple terms is such things as public order training, search training, and other types of particular tactical training, but it doesn't include firearms training and taser training. We also do an awful lot of police systems training. So when you look at systems such as the Police National Computer, the Police National Database, all of our mobile working solutions, the trainers within operational training conduct much of that training also. One of the biggest elements under my portfolio is the procurement and contract management of all mandatory training, which includes all crime and specialist training. So we spend quite a large chunk of our budget every year on training officers, on ensuring that they're maintaining their officer safety training, they're maintaining the driver training, but also some of the specialist skills that clearly the police need to have, and some of the mandated skills either from the College of Policing or other bodies to ensure that we're actually keep our licenses as an actual police force. So just apologies on this slide is a tiny bit missing at the bottom, but I'll explain what that bit is. So this slide is just going to talk through some of the trainer requirements. So all police trainers other than public order trainers that I've mentioned already require a level 4 certificate in education to deliver the core College of Policing products and to ensure that North Yorkshire Police has the right people in the right place with the right qualifications. Other specialist training qualifications are required within departments to ensure compliance with the mandated College of Policing and National Police Chiefs Council products, such as National Driver Training qualifications, personal safety training, specialist tactics such as SPEAR, which stands for Spontaneous Protection Enabling Accelerated Response, which isn't easy to say, but that's essentially a use of force tactic for officers to be able to protect themselves in certain circumstances. We're also, additionally, the trainers need to understand force systems in order to deliver training associated with them for the PNC and PND. A national trainer certificate is required for that. There are limitations that revolve around the trainer's operational use of such systems, and that's one particular area that we're looking at the moment. So, for example, the trainers who train that currently to the officers and staff that need it then aren't the ones who are using that system on a daily basis, which is actually a disadvantage. So we're speaking to some of those system holders to ensure that they look at training their own staff to be able to deliver that training, because you'll be able to deliver a much better product. And the professional development unit has been upskilled in intent-based leadership training. It's had a national tutor constable package and bespoke coaching skills, which many of the forces that have brought in PDUs haven't done, and that's to a massive benefit of our force that we have. The supervision within the unit require assessor skills and internal quality assurance skills at the national standard to ensure that the police constable degree apprenticeship programme is delivered effectively and in partnership with our higher educational institute, which is the Open University. But for some of the other explanations, there is a glossary of terms at the end of the presentation, because I do appreciate there's quite a few things on there. So to talk in more detail then around the PEQF framework, this is a slide that's taken from the College of Policing site, which basically gives a whole overview of the framework of the police educational qualifications framework, and it looks and starts from the PCSO apprenticeship side of things and moves all the way around to the strategic command course. So certainly over the last 2 years, policing across England and Wales has started to recruit and develop police officers and police staff, because it includes the PCSOs within that, around the PEQF framework to professionalise what we're teaching our workforce. And looking at, if we start at the PCSO side of things, so PCSOs have a level, or will look towards now, a level 4 apprenticeship, which replaces and improves on the current level 3 neighbourhood management award, which we certainly in North Yorkshire Police have been doing and still are doing, and it aligns to the police national curriculum. By working with the Open University as our higher educational institute provider, this allows recognition of prior learning will be accepted easier to establish, some of that transitioning then onto the police constable degree apprenticeship or the DHEP programme. So we also, when we look to recruit police officers, we look to the pool of the PCSOs that we have. So what we need to ensure that we're doing is that we start the PCSOs off on that journey of becoming, if they want to, a police officer. So we start them working with the Open University on a level 4 apprenticeship, so that if those choose that career pathway, it's a seamless move into the police constable degree apprenticeship. The next one that's highlighted in yellow is the PCDA. So that's currently no force is actually recruiting officers within the pre-join degree, as this is yet to be established and only went live fully online in 2021. Some universities have been able to work with the College of Policing to cross-reference their own policing degree within the standards of the new approved course, but there's insufficient applicants nationally to establish whether this is a useful entry mechanism. But certainly the actual PCDA is one of the routes and the main route that we use for police officers to come into North Yorkshire Police, and I'll go into that in a bit more detail. The graduate entry programme, which it mentions on the top right, so that's essentially the degree holder entry programme. North Yorkshire Police is still waiting to offer this route. We have sufficient degree holders within our PCDA, so we have over 50% of our PCDA recruits already have a degree. Nationally, the opinion of forces using DHEP is that it's an extremely challenging means of joining the police for student officers. There is no requirement to provide off-the-job learning, and this means students are struggling with their degree level 6 studies from the outset. In terms of the degree holder entry programme, that's something that we're having discussions on at the moment with the Open University, and something that we will look to bring in either at the end of 2022 or at the start of 2023. But yeah, as I've mentioned, that is something that a decision will be made in the start of next year around whether or not we go down that route. North Yorkshire Police does currently have several officers studying the level 7 apprenticeship master's qualification also. So moving on to the actual police constable degree apprenticeship. So we currently have, as I'll go on, there's around 74 officers currently on the PCDA programme. This shows and illustrates that it's a 3-year programme, so it's a 3-year probation essentially. Year 1, student officers complete their academic studies to level 4 higher educational certificate standard and provide sufficient operational evidence to demonstrate their independent patrol status. In year 2, they complete their academic studies to level 5 higher educational diploma standard and provide sufficient operational evidence to demonstrate, again, fully operational competence. And in year 3, they complete their academic studies and research level to level 6 honours degree and maintain operational competence portfolio through reflective practice and hopefully pass their endpoint assessment and then become a police officer. So in year 1, they get their 20 weeks initial training, and then they will go out into the professional development unit, which is the tutor phase, and they will be tutored from between 12 and 18 weeks before they will then go on to a response band and continue building their operational competency portfolio, continue doing their Open University academic work. In year 2 itself, there is an awful lot of attachments, which I'll go into a bit later on and bring out some more detail in terms of that. And the thing to remember in year 3 is this is when they do the dissertation. So we'll have done lots of different academic pieces of work up to that point, and then it's the dissertation in year 3. So that's the PCDA programme. So as you can see, there's some of the numbers there. As I mentioned, 74 officers already recruited within that programme, and then it gives a breakdown of the number of those officers that are actually at the different stages. But I think what I'll do now is just explain in a bit more detail around what the professional development unit is, because that's a really key element of how we are developing the new recruits within North Yorkshire Police. So the PDU was launched in November 2020 and has been developed to accommodate the new PEQF and the national uplift, and to raise operational standards to the highest possible level to ensure exemplary service to our communities. The PDU does have various key features which combine to optimise the learning environment and maximise success. So firstly, we have invested in our people to get results. So there are 45 officers and personnel interspersed throughout 4 strategic locations of Scarborough, York, Harrogate and Northallerton. So that's where we have the PDU hubs. We carried out specific staff development officers, so that's the tutors selection process to ensure that we employed the right assets. So previously, over the preceding years, we sometimes had to really encourage and force people to tutor new recruits. It wasn't something that was seen as a great option for PCs to be able to do. So what we've been able to establish now is a real unique recruitment campaign where we've got the right people with the right skills who are there to coach and develop the new recruits through what is essentially a really difficult 3 years. What we've done for the staff, the student development officers, is a bespoke 2-week SDO course. And because we've done a course, and previously it certainly was nowhere near 2 weeks, and a lot of forces nationally haven't invested as much in the actual SDOs. Those are the ones who are going to be tutoring the officers. Because we've done that, that's where we're seeing now some of the success of that and some of the excellent coaching and learning that's going on within those hubs. There's also a bespoke Open University SDO coaching course, which all the SDOs have had. The OU came up with that, and it's an excellent course. We have dedicated assessors who assess the work essentially of the new student officers, and they're all vastly experienced, recently retired officers who do remain operationally competent. And also we've got recognised qualifications to professionalise the team. So those who go through this process and the SDOs will have assessor and IQA qualifications at the end of it. Secondly, we have invested in our infrastructure within the PDUs and our processes. So we do have dedicated office provisions to create the requisite learning environment. We have an end-to-end review structure to ensure welfare and academic and operational performance. And we have bespoke performance dashboard to quantify that operational performance as well. It's certainly fair to say, and I spent quite a lot of time around the PDU offices around the county. There is an awful lot of wraparound support for the student officers within there, and that's from the inspector, the sergeants, and then the student development officers themselves. And what we have noticed is these student officers are exceptionally busy. We're in a time, and certainly have over the summer, of unprecedented demand, and all response teams were very, very busy. And although our students are in a hub, they are carrying an equal workload the vast majority of the time to normal response officers. So they're actually making a real difference on the front line as well. Now, the students are actually supernumerary to our numbers that we put out, and they can select jobs that they need for operational competency portfolio. Now, this is crucial to aid their development, and it's ultimately a more efficient way of doing it, as historically students were pushed from job to job, from incidents to incidents, with no debrief in between. So what's really good, and what I've witnessed myself, is when they go into jobs and they're coming back, they're actually debriefing them with their tutor, with their SDO, and actually having some reflective practice. So we're learning lessons really, really quickly, which is a really great way to learn, I think, for the students. They're on an actual bespoke shift pattern as well. So this allows then 20% of their time back to comply with the apprenticeship regulations. So this is aligned with the generic response shift pattern to give familiarity, consistency, and enables those relationships to be built with those response shifts as well. They have dedicated time to submit evidence records to satisfy their operational competence portfolio, and overall they have 25% off the job time dedicated to learning. Some will need more than that 25% because of the wraparound support that we give to them, but everyone gets at least 25% off the job learning. And then we're also continuing to do continuous programme evaluation to refine, develop and improve what we're doing already. A little bit more around the year 2 attachments. So during the second year of the programme, the students are required to undertake 4 key attachments to support their academic learning and increase their operational ability and preparation to achieve full operational competence at the end of the year. These are around crime, response, neighbourhood policing and roads policing. And throughout those 4 areas, they spend around 10 months on attachment, which is a real investment, which all of the heads of function have agreed to. Because if you think in year 2, that means that really they are not there on your response shift on year 2, albeit there is an attachment to response. They're already supernumerary and they're going to be in crime for 4 months, for example. That's a real investment, and the first lot of PCD are now into year 2 and they're actually working on a lot of their attachments already. So in addition, they give each department the opportunity when they go on their attachments to sell their line of work in a bid to attract the students when they achieve full operational competency. We really do need, and there's a national shortage of detectives across the country, and we certainly have a shortage of detectives within North Yorkshire. The reason we do a 4-month crime attachment is to encourage people to take that career choice. Not all will, but it's really important that we get that 4-month attachment right, and they actually see that that is the career path that they wish to choose. There is others that they may wish to go down, so we're not forcing them to go into the detective role, absolutely not, but we're just trying to nudge people that way. And a lot of the time when you come out of your probation previously after 2 years, you wouldn't have had a great deal of experience of the crime world or investigating more complex incidents. When our student officers are coming out of year 2 into year 3, they will have an incredible amount of experience, because 4 months within a CID will give you that experience. So that's just quite a bit of detail then around the professional development unit. So some of the challenges that we've certainly had have been around embedding the PEQF framework to enable easier recognition of prior learning for all compatible programmes. Cultural change has been a challenge to ensure support and acceptance of the new programmes across the organisation and challenge the naysayers. And I think it's fair to say that there has been some outspoken people around the country talking about, should police officers have to do a degree to be able to then become a police officer, or have a degree to get into it. And we're 2 years into the first lot of students in the 3 years. It's far too early to say whether or not this is going to be a success or not. But what I would say so far is I am immensely pleased with how the programme is going. I'm immensely pleased with the progression that the student officers are making, and they're learning an awful lot. They're learning an awful lot from the Open University. It's broadening their views in terms of those things that affect crime and antisocial behaviour and policing in general, and they're certainly getting that education at a very early stage, which will make their career much more fulfilling in the long run. Attraction and retention has been an issue, so we are closely working with the OU to ensure that we not only attract the right candidates, but we're able to retain them as well. What I mean by that is you do need level 2 English and maths to be able to get in now on PCDA, plus also that level 3 in terms of an A level or equivalent to get in. But many people who do come in haven't attended university. As I mentioned earlier, 50% have got a degree, 50% haven't. And what we found is the ones who haven't got a degree find it much more difficult than those who already have. And that's just the mechanisms of getting used to that new academic means of submitting evidence, really. So we work with the OU to ensure that we're not bringing in people who won't be able to cope with this very tough programme. In terms of financial challenges, we do pull from the levy fund for our PCDA programme, but once our levy fund is exhausted, which it will be soon, we will have to fund other apprenticeships up to 10% of the cost. So what that means is it's currently £23,000 out of the apprenticeship levy for a student on PCDA. That would cost the organisation £2,300 for each person we brought in on PCDA. This will be at a lower cost than the degree holder entry programme, which is £8,000 per officer. So when we're looking at whether we do DHEP or not, we also need to look at the financial cost to the organisation for that. New legislation is a challenge. An example of this is the increase in the officer safety training by 50% from 2 days to 3 days, which will start in North Yorkshire in early 2023. That means more abstractions from the front line, and it means a larger training cost, which will include the actual estate as well. There's also College of Policing and National Police Chiefs Council mandated legislation that we have to look at amending our training, and we have no control over all of this. And similar to other challenges may present themselves with driver training, which they have previously when changes come in, crime training, and all other nationally mandated training. So we're constantly amending what we do due to some of the national things that come in. And training needs analysis and evaluation is one of the most important challenges. That is something when we look at reviewing what we do in operational training, it needs to be one of the focuses of. So we only have one person staffing all of our evaluations and the costed training plan. And this is an area where we're left in need of review and support, either by outsourcing or creating a compliance unit potentially, who would review all of the courses that we do against the national standards and evaluate as and when required. So we need to understand we deliver an awful lot of training, but we also need to be able to evaluate that what we're delivering is actually making the difference that we expect it to do. So in terms of successes, now most of these do come under that we achieved them at the height of COVID restrictions, because we essentially did, which wasn't an easy thing to do. But we did complete the IPLDP delivery, which is essentially the old way of bringing in police recruits before they needed to then attain and work with the Open University. So we completed the last delivery of that at the very start of the COVID restrictions. The implementation of PCDA itself is a success for this force. Many forces have found it very, very difficult, and it has been difficult. It's been a challenge, but the fact that we have implemented it, we're into year 2 of the first cohort, is a success. I believe the partnership with the Open University themselves is a success. They're a tremendous organisation who have helped us immensely to implement PCDA, to come up with coaching courses, and they are very much an open door policy for us to go to them whenever we need some help and assistance, even around recruitment as well. I think the implementation of the PDU against the backdrop of COVID is a massive success. There's some exceptionally strong leadership from Inspector Lee Partridge and his team in there. The student development officers are trained to a very high standard, so 10 days compared to the previous 1 day. And all PDU staff are undertaking an Open University coaching course. There is blended learning embraced as part of our ambition to be a 70-20-10 organisation, which is 10% of that is face-to-face training, whereas most of the training we do is classroom face-to-face training. Currently, we need to go to a more blended approach. A crime delivery partner has created a blended approach to interview and initial crime training, which is really good. And officer safety training used a mixture of online demos and teams to ensure staff still had OST refresher training during COVID as well. So there's an immense amount done during COVID. And at the present moment in time, just upstairs at headquarters, there are some new training rooms that are being put together to assist in some of the challenges that we have moving forward, and the challenges that we've had previously in the lack of office space to be able to train the number of students that we've got coming in. And what I would say lastly is we will have a challenge next year when we bring in a double intake of student officers in January. There is an awful lot of work going on with various different departments across North Yorkshire Police to ensure that we have the sufficient resource and the sufficient estate and equipment to be able to successfully bring essentially 60 students in at once instead of 30 students in at once. The PDU will find it a challenge because we will need extra tutors. The states will find it a challenge because we'll need extra space, which is why we're making the changes now. But what success will look like there is that there is no the students who do come in, they don't see any negative impact of the fact that we've brought in a double intake, and that's certainly my objective, is to ensure that they get the best possible training and the best possible kickstart to their career, because the 3-year PCDA programme that they do is very challenging, and I'm looking forward to seeing the student officers come out of those 3 years, because it's a tough 3 years. It really is a tough 3 years, and some haven't made it already. Some unfortunately haven't reached independent patrol status, but that's a very small minority. The vast majority are doing an excellent job and serving the public of North Yorkshire in the means that we would expect. So I'm really pleased with how it is going so far. So that is a tour of as currently operational training, which is focused on the police educational qualification framework, explained a little bit around the PCDA programme, which is essentially the way that we bring in all student officers into the police at the moment. He's explained a little bit around the degree holder entry programme, which is another means in which we're going to be bringing people in likely into the organisation, but we need to consider the financial implications of that, and also look at how the student officers on DHEP have performed and what the attrition rates are around the country as well, because we need to learn from what others are doing around England and Wales around that. And hopefully you'll have some questions for me now that I'll be able to answer, but thank you for listening.
Mike, thank you very much. I'm sure there will be some questions. Can I just throw the floor open as we did before in relation to the thematic presentation? And Peter Mountain, you've got your hand up first. Pete, you're on mute.
Sorry about that. Thanks, Mike. That was extremely interesting, filled in an awful lot of gaps. Now, I don't know whether I interpreted this correctly, and you obviously mentioned if I didn't, but I got the impression that you're going to struggle with getting tutors and trainers for this and sort of encouraging them. So what are you doing to make sure you get and attract the right people to act as tutors and trainers?
Thanks, good question, Peter. It's certainly something that we're currently looking at and have looked at ever since we've recruited the number of SDOs, essentially. So I'll talk about the tutors first of all. So we have on paper 36, we should have 36 tutors or SDOs. We will need approximately around 54 to be able to successfully give one-to-one tutorship, which is really what you need to be able to give to those students coming in next year, which we'll need around June next year time. I don't think we'll attain those numbers realistically. The reason for that is there's various different other roles that officers want to be able to do, but one of the key ones is we need to make sure we maintain the service to the public of North Yorkshire at what will be a very busy time. So we need to ensure that we're putting the right numbers out on our response teams, albeit that will have a detriment on some of the other areas. In terms of attracting those people, there are tutor payments for some. Officers are rightfully paid a little bit extra when they take on a student officer as well. What we're doing is some work currently, and this is something Lee Partridge is doing, is talking to some other forces around the fact that they have been an SDO and a tutor, and that being recognised in promotion processes as well. So some forces are actually doing that. Now that would attract some more people to be able to do it, because it is really, it's an extra level up. You are supervising several student officers throughout the year and working at a different level in terms of looking at the development of those individuals. So you're being that person's teacher essentially. So it's giving you some really good skills, and so we're looking at, is that recognised anywhere within the promotion processes as well. What we're also doing is getting into the commands and talking to shift inspectors, talking to chief inspectors, and identifying those people who we believe have the right skills. And then quite simply, Peter, going and speaking to them. This isn't like an illegal approach in a football club or anything, and you go in and trying to take somebody. But we want those people to help us, because they will take somebody who's joined the police with hardly any experience whatsoever, and after 3 years you've got somebody who's hit the ground running and they are soaring ahead. That's what we want to try and achieve, the best possible student officer. So we'll go out and try and find those individuals as best we can. So we're doing as much as we can at the moment, but what we're going to have to do is probably take a bit of a blended approach to how we do it. So if we don't get enough student officers, some of those student constables will go out onto shifts earlier than they would have done. So they'll leave that environment of the PDU and they'll go out onto shifts, but they'll go out onto shifts with people who've got the relevant experience, and we will keep a really close eye on them. Because again, their experience over their tutorship period, I don't want it to be any adversely affected by the fact that we've brought in extra students at the same time. So it's all hands to the pump. What I would say is all the commanders are aware of this, got the backing of all the commanders. It's not certainly Mike Walker's issue or recruitment's issue bringing this in. It's the whole organisational issue. So I feel I've got the support that if we do need to release people, we'll release them very, very quickly and get them into our PDU, give them the 10-day course, get them working with the Open University, get them those coaching skills. Because let's not forget, they're actually getting professional qualification at the end of it as well. There aren't many forces where you will be able to get that as an SDO. So we're investing in them, but they're getting something out of it.
Thanks, Mike. Good luck with that. Cheers.
Thank you, Pete. Thanks, Mike. Tom, you're next.
Thanks, Mike. I guess a slightly different angle on Pete's question, I guess. Outside of PEQF, new student officers, how are you balancing the considerable requirements that have been placed on you to deal with all of the new qualifications framework and so on, and all of this training around uplift, Operation Uplift in particular, with the requirements of the rest of the service in terms of delivering ongoing continuous professional development, as well as new training requirements for different area, operational areas of the service? Because, as you'll be aware, there've been a number of requests recently for kind of money towards different training schemes, and it's interesting to understand why that isn't necessarily able to be delivered internally and the need to go external. So just wondered about the capacity issue within training more widely, please.
Really good question, Tom. So I think I would agree that there is a capacity issue for the force. I think when we want to improve in a particular area that we think it will deliver a better service to the public, training is one of the key areas that we'll look to train people on to be able to assist in giving that better service. So educating our workforce to allow them to understand things more in basic terms. So training is a key element of that. But when you've got several heads of function wanting to do that same training, and we do have a small training department, we struggle, which is why over the last 12 months we have outsourced some of the training. Now there is a budget to be able to outsource that training, so we have a costed training plan. So every year, each head of function has to put a bid in of what they need to keep operational licenses, as I mentioned earlier, to keep those specialisms going, and then some of the essential training that we need to do. So when we have digital forensics units and all, if we bring in something new into a policing organisation, it will need training and accrediting. So they put those bids in, and those bids will come to X amount of money per year. Whether we can afford that is where we need to then have discussions, because then we have to start moving different things around, say no to some training and yes to other training. But then coming at the other side is what I would describe as non-mandatory training, which is the stuff you're talking about, Tom, which is the extra stuff people want to do just to enhance. And we all want to enhance exactly what we do, but it's whether or not, one, we can afford it, and two, it's got capacity. But three is the biggest one for me, is then the operational impact that has on the front line and then on the public. Because if we are training, as we did last year, there was several pieces of non-mandatory training that had been signed off and agreed upon, which were conducted at the same time, which I think and did have an impact on the frontline resources, albeit it was rectified, but then the attendance to that training is vastly reduced. So if your attendance at the training is reduced, then you've got to question, well, why are we doing it if we couldn't afford, i.e. to take those distractions to do it? So one of the things I've recognised is a gap in governance, and a gap in all of those different things that are going on is, well, how do we prioritise what we're going to do, because we can't do them all, because we have been doing them all. So in, I believe it's the start of December, there'll be a skills and capabilities board that's introduced, where people, if they want to deliver that training, will write it. They will have to come and see key stakeholders first, one of them being myself, who will give them some advice on that delivery of that training, so the 70-20-10. So they might want face-to-face training, which is a big impact on the force. I might say, well, actually, it's just a video of two talking heads across a table, and deliver that. That's the best way of doing it. So they'll get my advice, they'll go to finance around the money, they'll go to a strategic resource and logistics manager, and they'll say this will be the impact if you do that training between, let's say, August and September next year. That will then go to a skills and capabilities board, and if 5 people go to that board with the requests, there'll be a decision made on which one we're going to be doing, if any, or all of them, because we might be able to do all of them. So that's where that will be gripped, because at that board, you know, I might say, well, we can't do it, we don't have the skills and capabilities within our team, you'll have to outsource it as well. But what we're doing now, though, is a review of the operational training function to look at that one of those particular areas. So this board's coming in, yes. So that's that stopgap for now, and that will remain. But let's review and see, well, do we need those skills and capabilities within our operational training team? Because we probably will for some of it, but we probably won't for some of it, because sometimes it's easier and more cheaper to do it and outsource it that way. And that would be a decision that I would say, yeah, that's absolutely, they're the ones who are skilled to do it. It would cost us a fortune to develop our own team. We might only do it once or twice, so yeah, outsource it. But we need to wrap it around that skills and capabilities board. We need to educate the workforce and the heads of functions to ensure this is the process you need to go through, because I appreciate some people have come to you, Tom, or the OPFCC for funding. That might be a quick yes. So there's no issues financially. You know, I might give an advice on how to train. That might not be taken, and then it might get signed off somewhere else. And lo and behold, then we're doing the training. We need to just get our, you know, that act in order, and the skills and capabilities board will be able to do that.
Thanks, Mike.
Thank you, Tom. Thanks, Mike. Conscious of time, I've got 2 colleagues indicating. So can I take Peter? I think you were first, weren't you?
Yeah, thanks. Hopefully it's a straightforward one. I was concerned, Mike, when you were talking about your evaluation or validation, as I called it, and you'd only got one person to do it. It does set a few alarm bells ringing, because if you can't validate your training, you don't know whether you're wasting your money on it. Have you considered other routes with this, like perhaps contracting that provision out to get that done?
So the quick answer is that the review that we're currently doing through our business insight team, that is one of the areas that they will look at. So we'll be looking at some benchmarking of how other forces and organisations do it as well, but all options are open to us. The key thing is we do need to evaluate better. We need to do our training needs analysis better. We need to evaluate better to understand that actually the public are getting their money's worth in terms of the money that we're spending on training for the organisation.
Thanks.
Thanks, Pete. Thanks, Mike. And Caroline.
Thanks, Simon. Yeah, thanks, Mike. Great presentation. I'm just going to touch on the shortage of detectives. Just an interesting point with the opportunity of the 4-month attachment. Is there a point in the process in which officers would sort of declare that they're interested in terms of becoming a detective? And have you got an expected sort of conversion rate, you know, that would help potentially fill that gap? It's just if you could touch on a bit more on that.
Yeah, I don't have an expected conversion rate, but if you spoke to the head of crime, they would say 100%, please. So anywhere 100% and somewhere between 50 and 100 probably. In year 3, they make a preference in terms of where they want to be going, essentially. So when they hit year 3 and they start doing their dissertation, that's when we expect them to say, right, this is the route I would like to be able to go down. But I think over the hill, there'll be other specialisms that will form part of the PCDA, that there are other gaps around certain areas of policing, but they'll be competing against each other. I think what we need to do is get the detective one sorted first of all before we start encouraging people to go down various different routes. Because one of the core elements of policing is response policing, and that's one of the areas that's always pulled from to fill detectives, neighbourhood policing in various different areas.
Yeah.
If that's not done right, you'll find that you don't have enough experience and enough numbers on your response teams, which is answering your 999, your emergencies, that first officer on attendance. So we just need to get the balance right. Definitely, but you know, we do want detectives is what I would say.
Thank you.
Well, thanks everybody. And as far as I know, we've not received any questions from the public so far during the course of the meeting. But could I just on behalf of the public of North Yorkshire, New York, just ask Lisa and or Mike just to close out really in terms of the sort of key takeaway points from this themed presentation for the public, please.
No, go ahead, Mike, and then I'll finish off.
Yeah, it's just hopefully that does, and I know it's quite complicated and it was a relatively quick presentation, but essentially the key takeaways from this are that it is successful so far is the new way of recruiting police officers. There are new ways of recruiting police community support officers. Special constables will be the next one. It's an educational framework if you want to join the police nowadays, but it's not. You will get immense support throughout and coaching throughout that. So, you know, we still want people to apply for the police. Absolutely. There'll be different entry programs coming in to allow us a little bit more diversity in terms of those people who've got degrees already who want to come in. North Yorkshire Police is an excellent organisation to work for. And certainly the proof is how some of the student officers are currently performing and getting supported throughout the organisation is what I would say.
Thanks, Mike. And I suppose just to then take that to the next level in terms of its breadth. So we've got a very skilled, experienced, tried and tested operational training team here in terms of those new people coming into the organisation. But of course, we don't deliver all of our training ourselves. There are lots of national training programmes in terms of accrediting people in other specialist skills such as firearms, public order, etc. So I would just want to say there's a balance of individual force training and operational training, which Mike has done in detail in the presentation today, but that is balanced with and complemented by the College of Policing, the broader national accredited training that we provide, and those skills are then available to the public of North Yorkshire. They bring those skills back to the organisation at a national standard level to deliver an exemplary service to the public. And of course, the balance that Tom and Peter have talked about comes not only from our newly appointed student officers, but of course we recruit trainees, we transferees, should I say, that we bring into the organisation who already have those skills. So to your point, Caroline, about experienced detectives and the gaps in detective cover, that there are people working in other walks of life in law enforcement and in other forces where we don't always recruit in brand new, that we do bring those skills into the organisation as well. So there's that balance across the training landscape and the skills balance across the organisation with newly recruited people and existing skills in policing and law enforcement.
Thank you, Lisa, and thanks, Mike, and all who've contributed to that particular item. Thanks ever so much. That takes us to item number 7 on the agenda, which is the overall police performance update for this month. And Mark, we're with you, I think.
Yes, that's correct. So if I can just find the presentation, which has miraculously suddenly disappeared. So I wonder if someone else could bring the presentation up, please. Is someone able to bring that up?
Yeah, I've got it here.
Just literally it disappeared from in front of my eyes. That's great. If we're able to get down to full screen, Tom.
Yes.
That'll do. That's great.
I can do.
Okay, thank you. So I will give an overview of the force performance as it stands. I'll work on the exceptions because of time, starting with the key issues that the key issues that I know that we have been aware of and concerned of, and we'll start with the force control room in both our 999 and 101 numbers. So people may be aware that we have a target to respond to emergency calls, the 999 calls, within 90% within 10 seconds. We have various mechanisms to be able to do this with an initial primary line and then subsequent secondary and alternative lines, even including other buddy forces to make that happen. As it stands at the moment, we had about 52% of our calls within the service level agreement within the last 12 months. Which means that we've still got a significant number outside of that service level agreement. But I think it's hopefully reassuring that the average time in September was just under 24 seconds. Now that includes the ones that we're really hanging on, and those also that were answered very, very quickly. But we are getting over 50% within the service level agreement, which needs some work on, but I'm reassured that we do not lose 999 calls because of this filter that we've got. Now, in September, what we noticed is that we got about 8,700 999 calls in September alone. That dropped compared to August, and we had been seeing an upwards trend all the way from February upwards. But interestingly, September still was the highest month we've ever seen. 8,716 calls alone on our 999 calls in September 21. If we looked at the year previously, that's 7,500. So significant, over 1,000 more than we had in the previous year. Where we do have spikes of time taken, we obviously have to really look at that, trying to understand why that was. And if you can see on that bottom graph on the 999s, you'll see in late September 26th, we had some significant time taken to take calls, and then we review those to work out exactly what's going on. So hopefully we can resolve that. If we can move on to the next slide, please, Tom. So here, what we're seeing is that our 101, so this is our standard calls, and we get roughly twice as many 101 calls as we do 999s. Our abandonment rate was about 24%. We answered within our service level agreement, so that's within a 2-minute period, about 36%, although encouragingly the last 7 days we're up to 43% there, and we're still best part of 40% outside of the service level agreement. This clearly is not where we want to be. A huge amount of work is going on, not least having a specific gold group set up to look at all the challenges around call handling, and that now is also being merged with our response gold, because in reality we've got two sides of the same coin to look at how we make sure we are most effectively answering calls and responding to calls. So the average time in September to answer a 101 call was just over 5 minutes. That is getting longer than we've had previously, but we're looking to work out various different ways that we can address that. So we do need to be increasing our overtime to get through this this period. We've got high overtime already in the force control room. Some things are going to really help us. We're getting some call prediction software in, which is really going to help us monitor when calls are coming in and likely to come in, so we can improve our workforce planning to make sure that we're providing additional resources when they're required. We're providing a lot of training on the system upgrades that we've got, but we recognise that we've got fairly high sickness. We've got fairly high inexperience in the force control room, and certainly you can see, for instance, on those two graphs below, September the 13th, where you saw a big spike in average time, and also a lower number of calls answered and a higher number of calls abandoned. We understand those correlations, and we work really, really hard to try and make sure that we can address those gaps. But where you have high sickness, obviously we only have a limited number of people who are trained and qualified to provide a good quality service to the public, and that's where we suffer. But we are looking at every opportunity and possibility through our gold group, making sure that we are in as good a place as we can be to respond to the public's demands. If we move on to the next slide, please. So there you'll see we have two key grade response, our immediate grade response and our priority grade response, which are essentially when police officers go out. And you'll see we have got a downward trend in numbers in IRs and priority grade incidents. Interestingly, here you'll see that at the bottom, public safety and welfare calls result in the majority of calls, but the crime calls take more officers to deal with them. And so it's interesting just being able to balance that. If we look at the types of calls specifically around crime, Tom, please, to the next slide. What we're seeing here is looking at where in the last 4 weeks compared to the previous 4 weeks, what are changes. And interestingly, I mean, this was 30th of August to 26th of September compared to 26th of September to 24th of October, 2 weeks ago. And you'll see we are seeing a decline in virtually all crime types. Obviously, we are looking at some significant volumes and obviously need to look at numbers as well as the percentages. But we are seeing a decrease in crime, which is not untypical, it's not unusual as we move out of the summer period into autumn and winter. What we then need to do, of course, is monitor when those crimes are happening and what our spikes are and when our times of day that offences are happening are, so we can tailor our response not just in the force control room, but actually on the streets as well. And what we've seen actually is in the last 4 weeks, Tuesday suddenly has gone up. We don't know why. It's unusual for Tuesday to be a crime spike, but we've had that, and we're looking to try and find out why that is specifically. But if we look, Tom, at the next slide, when we dig really deep down into the crime volumes, violence against a person always comes out on top. So in the last 12 months compared to the 90 days, compared to the 30 days, you can see that violence against a person invariably is the highest level of crime. Some of that will involve physical violence, as in visible violence. Other will be some forms of non-visible assaults of various types. This is a national crime recording standards that we work to, but 38, close on 40% of all offences that we deal with are violence related. That hasn't changed much in the last 12 months, but obviously with the nighttime economy building up, we are seeing some increases there. Tom, you want a question?
Thanks, Mark. Sorry I'm a bit late coming in there. Just to look at drug offences again. I mean, over the last few months, we've had quite a steady increase in drug offences, and obviously recognise that that's often because there's the police are catching more people around drug offences because of the nature of what drug offences are. But that's dropped off again recently. Any particular reason for that? Is it just seasonal, or are we unable to do as much proactive work around that?
Yeah, so from October 2020 through to the end of September 21, we are seeing a decline in drug offences. That is all offences, and obviously possession or possession with intent, which can be self-generated, is typically due to proactive policing. Now, I can create a profile here to be able to confirm this, but I think your hypothesis that maybe because police officers are busier with other things in a post-COVID environment may be one of the reasons why we are seeing less possessions caught. We did see a big correlation with people being stopped for COVID offences and also having, for instance, cannabis on them. We're not stopping people for the COVID offences anymore, and therefore we're not getting those associated offences where people are in possession of cannabis. I would have to do some more work in that, but I think it's a reasonable hypothesis.
It is an interesting one, and we are getting an increase of correspondence into the office at the moment around concerns from communities about drugs and perceptions of dealing and so on. So it may well be worth a bit of a look, because that
So one thing obviously we're looking at is specifically through force tasking where our key drug related priorities are, and personal harm related to drug related activity is where we will priority our drugs policing. And so where there is, for instance, misuse through county lines, where there is abuse of drugs and where there's potential risk of death associated with drugs, that's where we will prioritise our activity if we're able to. But whilst we're on drugs, I might as well talk also about spiking at the moment. Because I think it's a highly important and highly emotive issue at the moment, both from a needle-based spiking and just general drink spiking issue. And just so you're aware, we've had about it was 34 offences in the last few months since August, where we've had spiking reported to us in the county. This is predominantly associated with the nighttime economy. We've had only one incident of a needle-based spiking offence being raised with us. The rest have been drink spiking and mainly through the nighttime economy in pubs and clubs. We provide a lot of advice to members of the public, mainly women, and mainly students as well, on how best to protect themselves. And I'd like to say that the nighttime economy, the licensed premises, are acutely aware of the claims that are being made and the national interest in this. And we're working really closely to make sure that people are as protected as possible against what people believe is happening. I'm using my words carefully here because we're obviously trauma informed. We're obviously very concerned about what people are saying is happening. We're desperate to get the evidence to be able to prove what is or isn't happening, and we're working with our health colleagues and local authorities and the nighttime economy especially, to make our nighttime economies as safe as possible. And where we have trends at certain premises, we're working closely with those, as we are with quite a few premises within the county. So mindful of time, if maybe we could just flip over 2 slides onto slide 8, which is dealing with crime over the last 24 months. That's the one. We'll just keep talking about the violence offences. Interestingly, there we're seeing the majority of most of the violence that's happening there, and you'll see the way that the chart is going from October 2 years ago to now. Scarborough 9,000 offences, York 8,700, and Harrogate 5,000. So Scarborough is where our priority is for violent related offences. Sexual offences, significantly lower numbers of sexual offences, but each one obviously is treated exceptionally seriously. Scarborough 637, York 600, and Harrogate 366. And then if we look at acquisitive crime, interestingly, York hits the top there, but because of the retail sector, one would anticipate that to be the case, I would suggest. And that's of no surprise to us. And then offences in Hambleton, Selby and Craven are significantly lower. So if we move on to our crime investigative outcomes, we do have a positive outcome ratio compared to other forces. The resolved rate of 15.56%, you may think is quite a small percentage, but relatively speaking, compared to the rest of the Yath region, compared to the rest of the North East, and compared to North Yorkshire's most similar forces, it's a positive figure. Now, we know there's many reasons why we don't always succeed in being able to get people prosecuted for offences, and there's a breakdown there as to the reasons why, be it for victim reasons, because we've never been able to find an offender, because of issues with the prosecution, or sometimes because we are waiting for the criminal justice process to progress. But we've got a breakdown there as to what we expect. What happens, of course, is the further in time things go on, the more likelihood we will have had a prosecution of a specific offence. But I think it's been well publicised, the delays in the general criminal justice system post-COVID, which obviously we are working hard with partners to make sure we can get people through the prosecution process where it is appropriate. I think page 10, the next page, the victim's journey, specifically around victims code, we have covered. I covered last month, just to say that we are waiting literally any day now, and I was hoping it's going to be today that the Ministry of Justice was going to provide guidance on how they want the victims code to be reported on. As soon as we've got that, it's going to be all steam ahead to make sure that we are both complying with that and also putting our mechanisms in place to make sure that we are really actively and accurately recording the victim journey. With regards to stop search, the data is there. We still have a community review groups. We still have our scrutiny panel. We have lay observers. We now have body-worn video for everyone who does a stop search, and we have specific single points of contact within our police stations to make sure that we are not disproportionate with stop search, to make sure that we are actively using it where appropriate, and making sure that we are monitoring trends. This is work that's always going to be sensitive, but is very much active and ongoing. Moving on to our workforce, obviously you've heard from Mike earlier on about how we're training people who we're bringing into the organisation. Our target for March, the end of March 22, is 1,567 officers. A lot of work is going on to make sure that we hit that target, and a lot of innovation is coming in as well to make sure that we are getting direct entry detectives, for instance. We're looking at returner schemes, we're looking at rejoiner schemes, we're looking at various different ways to make sure that we maintain and can generate the best people possible to provide policing in North Yorkshire. We are very much on target there. We are mindful that we may also have an exodus of individuals at the end of the financial year for various financial reasons. That is, however, being monitored and rigorously checked to make sure that we are where we need to be, supporting and benefiting from the uplift. And then perhaps finally, just going through to the final slide, Tom, you've got what looks like quite an alarming graph there around COVID sickness with 23 people off. That's actually, relatively speaking, quite positive, because back in the day when we were in the height of our COVID problems, we had well over 100 people off self-isolating. We now have only 9 people self-isolating because of COVID, but we have some sickness absences there. Predominantly, these are parents of school-aged children, which is very consistent with the story that's happening throughout the country. I know that North Yorkshire was in the headlines last week for high figures, specifically in the Harrogate area, but we are not out of kilter, and we are managing well with our COVID sickness absences at the moment. These are, however, being monitored on a daily basis, not least this week and next week, whilst we have so many of our colleagues up in Glasgow supporting the COP26 conference. So, Simon, colleagues, that was a whistle-stop tour through. I hope it wasn't indecent haste, but if there are any further questions.
Well, it looks as though there's one, Mark. So, Simon Jones, you're indicating? Perhaps you're not. Right. Okay. No problem. Simon often asks the most poignant questions in team meetings, so that should come as a relief to you, Mark. Tom Thorpe.
Sorry, I wasn't able to get to it earlier because I was sharing the slides, and so I couldn't flick between them as I normally do to double check things. It was just a question around the 101 and the 999 call figures earlier on. You mentioned in particular a spike around the 13th of September, and there were also spikes kind of later on in September. But when look at often it takes us longer to answer 101 calls because there are more 999 calls. But that doesn't look to be the reason, looking at the 999 call figures. So I just wondered whether there were any specific reasons why there were those spikes that have been identified and work to mitigate them.
The 13th was about sickness. We had high levels of sickness on the 13th, which is why the time took longer, less calls were answered and more calls were abandoned. We got a direct correlation there. September the 26th, which was specifically around 9s, not 1s. We've done some research. There was a spike of a couple of jobs around about 1 to 3 in the morning. But there was no huge trend that generated any concern that's resulted in further conversation to be able to prevent that happening in the future. Okay. It was just one of those spikes, but it's very useful to have this data to be able to ask those questions.
Yeah, no, that's fantastic. Thank you very much.
Thank you, Mark, and thanks everybody. Does anybody else have any questions? And I'm just going to check before we close the meeting. Have we received any questions from the public? it seems we haven't. So thank you, Simon. Thanks very much. Okay, well, look, thank you everybody for your contributions. These presentations don't write themselves, and they're not delivered in a way which doesn't involve quite a lot of thought and work. So thanks very much for that. Our next meeting is on the 7th of December 2021, and hopefully viewers for this meeting will be able to tune in on that occasion as well. So thanks very much indeed. Take care, everybody.
Thank you. Bye.